So hi guys, you are welcome to Dssg Nation. So if this is your first time watching a video from Dssg Nation, do make sure you subscribe and you hit the bell button so we can notify you whenever we create any video. So today we are going to be talking about the application of nursing care plan. Now, before we do that, I would like to give a quick recap on nursing care plan at large. So in our previous video, I said nursing care plan is a framework for providing or rendering a quality nursing care. So I said we have 5 components. So the first one, the acronym for the 5 components is NOISE. So the N is the nursing diagnosis, the O is the outcome identification, the I is the nursing intervention, the S is the scientific rationale, and the E is evaluation. So I said for the N, the nursing diagnosis, it means a nursing problem. And I said we have majorly 2 types of problem. The first one is the actual diagnosis, and the second one is the potential diagnosis. So I said the actual diagnosis is a kind of diagnosis that is present, the problem that the patient is suffering from at the moment. So, and for the potential diagnosis, I said there are those disease conditions that the patient is prone to. And then we said the format for writing the actual diagnosis is the PAIRS format, which means problem related to etiology, evidenced by sign and symptoms. So for the potential diagnosis, I said the format of the potential diagnosis is risk for dash, and that dash is the disease that the person is prone to. So and after then we talked about O, outcome identification. So I said outcome identification is identifying the result, and I said simple. The format for that is what? The format for outcome identification is patient will dash within dash to dash of nursing intervention. So I said patient will dash. The first dash is just a sentence that solves the problem. For example, if it is pain, it will be patient will dash, and that dash will verbalize less pain. So patient will verbalize less pain. Then the format says within dash to dash of nursing intervention. So the first dash is what? Is the time, while the other one is the time as well. So 30 to 45 minutes of nursing intervention. And that is that about outcome identification. So the next one is NOISE, N-O-I, the nursing intervention. So I treated the nursing intervention and the scientific rationale simultaneously, that is together. So I said for the nursing intervention, you have 1, 2, 3, and 4. So, and the first one is constant. It is what? The format is assess the level of dash, and the dash is the problem of the patient. And then I said every nursing intervention used to have every first nursing intervention rather. So the one assessing level of the problem. So it used to have the same scientific rationale, and that is to observe baseline data. And then the fourth one will be what? The fourth one will be administer prescribed dash, and that dash is group of drug. So the mode of action will not be what? I mean the scientific rationale, the reason for doing that will be what? Will be the mode of action of that drug. And lastly, the evaluation is talking about what? It's talking about the outcome of everything you've done. So you are checking it, maybe your nursing care or your outcome identification has been actualized. So if it has come to reality or not. So, and the format for evaluation is what? Patient dash after dash of nursing intervention. So the first dash, patient dash. So the meaning is what? Patient. So the past tense of the sentence of the problem. If you are using pain, it will be patient verbalized less pain. Then after dash. So dash, you pick the initial time, 30 minutes of nursing intervention, and that is that. So today we are going to be applying nursing care plan to a condition, and that is a post-operative condition. So but before we proceed with that, I would like to give you an example of what used to happen during surgery. So stay tuned. Yeah, welcome back. So I said we are going to be talking about a post-operative disease condition. Now, do you know the advantage of this? Regardless of the disease condition, once the question is asking you for a post-operative disease condition, you can always put this nursing care plan into it, and you are going to get your full mark. So let's proceed to that. But before I proceed, let me tell you what used to happen when someone goes for surgery. Now, when you go for surgery, either mastectomy or gastrectomy or any kind of surgery, just know that there is going to be something called incision on that person, and the incision is the site of the injury. So naturally, the surgeon is going to pick a knife and is going to dissect the person. So that is what is going to happen, that you have to put in your mind as someone who wants to write a nursing care plan. So let me quickly pick my marker. So I said, for someone going for surgery, they are going to make some kind of incision on the person, and that is what? Surgical incision. So like a cut. So this thing is going to result to a problem, and as a nurse, that is what you are supposed to fix with your nursing care plan. Now, which problem is it going to result to? It's going to result into the problem of pain. So the person is going to have pain due to that surgical incision. So this will be the cause of the what? Of the pain. Now, the next thing I want you to know is that this person, for the person not to feel the pain at the moment of surgery, so while they're performing the surgery, the person won't feel the pain. But why? That is because they are going to give the person anesthesia. Anesthesia. So anesthesia is that drug that used to reduce the perception of pain, or it even kills the perception of pain. Like you won't feel pain at all. So now that anesthesia, it has a side effect, and that side effect is what do we call this? Accumulation of secretions in the airway. So there will be accumulation of secretions in the airway, and hereby leading to what? Difficulty in breathing. So I want to use difficulty in breathing. Let me call it ineffective breathing pattern. So that is another problem that the person is going to have. Ineffective breathing pattern. Now, if you take a careful look at this, you will realize that all these things are going to be the problem that the person going for surgery that is going to have after the surgery. So, and this pain is caused by what? By the surgical incision. And this ineffective breathing pattern is caused by what? It's caused by the effect of anesthesia. The effect of what? The effect of the anesthesia. So that's the effect of the anesthesia. So now, I'm going to clean this, and then we start drawing the nursing care plan. So stay tuned. So I said the problem that the person going for surgery is going to have, one is what? Is pain. And the second one is what? Ineffective breathing pattern. Ineffective breathing pattern. The person will not be able to breathe very well. Ineffective breathing pattern. Now, what leads to this pain? That is surgical incision. That is the cause of the pain. Surgical incision. And the cause for this ineffective breathing pattern is what? The effect of the anesthesia. The effect of the anesthesia. So, if you want to write a nursing care plan, you start with your what? Your nursing diagnosis. The nursing diagnosis. So, what is the format for writing nursing diagnosis? That is the PES format. PES. So, what is the real format? It is problem related to etiology, and then evidence by sign and symptom. Now, using this, you want to write a nursing diagnosis for this patient, this post-operative patient. So, you want to pick the problem. So, what problem will the person have? Pick the first one, pain. So, you saw beating, the problem is the pain. So, you bring in your related to, you write it again. So, related to, that is caused by etiology. So, what is the cause? The cause for this pain is what? The surgical incision. So, related to surgical incision. And Evidence by will come back to its place. Evidence by the sign and symptoms. So here you have verbalization, patient's verbalization, patient's verbalization, verbalization. So patient's verbalization. The patient is going to tell you that things. And now this is an accurate nursing diagnosis, an actual diagnosis to be precise. And now to the second one, let me quickly check my marker, please. So to the second one, this is a problem, right? So let's use this format again to write a diagnosis for this. So the problem will be what? Ineffective breathing pattern. Ineffective breathing pattern. That is the problem. So then related to coming, related to. So what is the cause of the ineffective breathing pattern? That is what? Effect of anesthesia. Related to effect of anesthesia. Anesthesia. So then you bring the evidence by. So evidence by dyspnea. By what? Dyspnea. Now what is the meaning of dyspnea? This means difficulty. Difficulty. And dyspnea, it means respiration. So we have different type of apnea. We have apnea, eupnea, and the like. So we'll be talking about that in vital signs. So dyspnea means difficulty in breathing, or you say difficulty in what? In respiration. So these two are good nursing diagnoses, and they are what? They are actual because they follow the PENS format. So the second type of nursing diagnosis that I give to you is what? The actual diagnosis. I mean, sorry, the potential diagnosis. For the potential diagnosis, I said it is what? The format of potential diagnosis is risk for dash. And now, what is that dash? That dash is the disease condition that can happen to the person. So the complication, it can even be complication as well. So this will be risk for infection most of the times. Risk for what? Infection. We used to use risk for bed sores because the person is in the hospital, so there is a risk for what? Bed sore. But for surgery, the best thing you can use is risk for infection. And those are the three nursing diagnoses. Now, let's come out with a chart. I mean a table for our nursing diagnosis. So I'm going to do everything there. And we're going to, let me give you that as an assignment. Let me just do it like this so that we can see the board vividly. Because if I start to make demarcations of the board, my writing will become smaller. So that is that about the nursing diagnosis. Now let's treat each nursing diagnosis now using our noise. So let me clean the board. I'll be right back. So nursing diagnosis. So let me just draw the table. I will make it as clear as possible. So that is N. So the next one is what? Outcome identification. Outcome identification. Identification. So let's treat these two together again. Okay, outcome identification, then nursing intervention. I want to treat the nursing intervention and the scientific rationale together. So let's treat this nursing diagnosis and outcome identification again. Now, for a nursing diagnosis, we said it is what? Problem, which is the pain. Related to what? The surgical incision. Related to surgical incision. And evidence by what? Evidence by patient's verbalization. Patient's verbalization. And this is what? This is the nursing diagnosis. Now, what is the outcome identification for this diagnosis? Now, the first thing you remember is what? The format for outcome identification. And that is what? Patient will dash within dash to dash of nursing intervention. That is the format for outcome identification. Then what are you going to do? You fill in the gap. So it says patient will dash. So the first dash is what? Solving the problem with a sentence. And now what is the problem? Pain. So patient will what? Verbalize verbalize less pain within, then this is time to time. So you pick 30 to 45 minutes of nursing intervention, and that is what? That is the outcome identification. So let me come with the nursing intervention and the scientific rationale underneath. No, let me just explain it. So now the next thing is what? Nursing intervention. Nursing intervention. And after then you have your scientific rationale. So we said the nursing intervention means what? Action. And the rationale means what? Reason. So I said the format for nursing intervention is just 1, 2, 3, and 4. You have to write for nursing intervention at least. So what's the format? Is that the first thing is what? Assess level of dash. And that dash is the what? The problem. Now tell me, what is the problem of that person? That is pain. So you say assess level of pain. And then you come in with your reason. And I said everyone is the same thing. And that is what? To observe baseline data. To observe baseline data. As simple as that. Now, that is 1. Now 2. All these interventions, you have to think yourself as a nurse that what can I do to alleviate this pain? So without wasting much of our time. Another thing you can do is to do what? Is to put the patient in a comfortable position. Put the patient in a comfortable position. So someone that is done with surgery, an abdominal surgery, you can't lie the persons down in a prone position. So that will not be comfortable for the patient. So you have to do what? You have to do supine. So, and that is about the comfortable position, the comfortability of the position's patient. Of the patient's position rather. Now, 2. So what is the reason for doing that? If you lay the patient down with the surgical site, it is going to increase the pressure on that site, and it can do what? The wound can gape again. So just say to relieve pressure from the site of incision. From the site of incision. So you can have different reasons. So nobody is going to crucify you for picking a reason. Just make sure what I'm saying is what is going in line with your nursing actions. So now the third one is what? You can say give diversional therapy. Give diversional therapy. So it's like you are going to divert the patient's attention from you are going to take the patient's mind off the disease condition by giving what? A diversional therapy, to divert. So you can put example, e.g. So if the patient is just a child, you can say watching of television, TV. But if it's an adult, you can say reading of newspaper. So and that is that about the third intervention for pain. So now the third one here, what's the reason for doing that? To lift the patient's mind. To lift the patient's mind off the pain. So that is the reason. So, and last one is what? What's the format of the last one? Administer prescribed dash. And that dash is what? The group of drug that you are going to use for the problem. And that is what? Analgesic. Analgesic. So you can say e.g. paracetamol or acetaminophen. So 500 milligram TDS. That is that is 500 milligram. No, sorry, it should be 1000 like that. 2. So 1000 milligram TDS, 2 in the morning, 2 in the afternoon, and 2 at night. And now, what will be the mode of action? The rationale for giving this drug is what? The mode of action of this drug. And that is what? The mode of action of analgesic is to what? To block the pain pathway. To block the pain pathway. So, and that is that was on the nursing intervention and the scientific rationale for pain. So, the surgical pain. Then the next one is what? The last thing now is evaluation. So let me just give you the evaluation here. So for evaluation now, the first thing you remind yourself is what is the format? The format is what? Patient dash after dash of nursing intervention. And the first dash is what? The problem solved in past tense. Now, dating back to our outcome identification, I said it is what? Patient will verbalize less pain. Now, this one will not be what? Patient, then you remove the will. Patient verbalized. So this will be in past tense now. Patient verbalized less pain. So after dash, this is the time, and you pick the what? Your initial time. 30 minutes of nursing intervention, and that is all about the what? That is all about the pain. So let's move to the what? To the second problem. So right now we are going to be talking about the nursing care plan for ineffective breathing pattern. So we are going to use our noise to solve it. Now we already know that the nursing diagnosis is what? Ineffective breathing pattern. Ineffective breathing pattern. Actually, all these they are from NANDA, but trust me, you don't have to be disturbing yourself about your NANDA. Just make sure you subscribe to this channel, and we are going to be giving you the latest NANDA, so you won't have to just be buying the NANDA and then be cramming it without knowing how to apply it. So, ineffective breathing pattern related to what? The effect of anesthesia. Related to the effects of anesthesia. And then evidence by what? Evidence by dyspnea. And I said dyspnea is difficulty in breathing. So that is what? The nursing diagnosis. And this one is what? Outcome identification now. Outcome identification, noise. So now for the outcome identification, the format is what? Patient will dash within dash to dash of nursing intervention. So what's going to happen now? It will be patient will dash. So you have to solve the problem in what? In the sentence. So the patient is having a breathing problem. So you say patient will maintain normal respiration within 30 to 45 minutes of nursing intervention. So that is outcome identification. All you have to bring in is your format. Once you know your format, trust me, you won't have issues. So if you are still yet to cram the format, make sure you do the cramming right now. So the next one is what? Okay, let me tell you what I'm coming with, the nursing intervention and the scientific rationale. So now we're going to talk about the nursing intervention. Nursing intervention. So I said intervention means what? Action. Nursing intervention and the scientific rationale. And the scientific rationale is what? The reason for that action. So the first thing you do is what? You assess the level of the problem. So 1. Assess level of respiration. So the next thing is what? The reason is what? Constant. To observe baseline data. Or you say to serve as baseline data. So baseline data. So that is 1. Now the 2 is what? The 2 is the action that you can do to increase a person's respiration. So after surgery, we used to perform a post-operative bed, and then we do what? We tilt the patient's head to one side, just on a flannel. So to do what? To prevent aspiration. So that is an intervention. So you say, turn the patient's head to one side. So rationale will be asking you why. So to do what? To prevent aspiration. To prevent aspiration. And another thing you can put there that will go to that will really go with our lesson diagnosis is like to help clear the airways from secretions. So the third one here, what can you also do to improve someone's respiration? So you can do what? Give oxygen therapy. So oxygen treatment. So, and what is the reason for that? To increase oxygen saturation. Oxygen saturation in the blood. So oxygen saturation. So what are the other things that you can do? So for someone that is having difficulty breathing, so you can give the person, okay, now the first one is a drug. So administer, so the format, administer prescribed. So the group of drug you can use to enhance respiration is bronchodilator. Bronchodilator. So example is aminophylline. Aminophylline. So your mode of action will be what? Your mode of action will be your rationale will be the mode of action. And the mode of action is to dilate the bronchi. To dilate the bronchi and enhance breathing. Although you are talking deep pharmacology, we'll be talking about adenosine diphosphate. So we are not just going to be using this. This is just too light, but just a nursing care plan. A nursing care plan, you can just put it there. So that is that about this nursing intervention and the scientific rationale for ineffective breathing pattern. So there are still other measures you can use to do it to improve a patient's respiration apart from all these, So another thing is what? You suction the airway. 5. You suction the airway. But this should be the last one. So you suction the what? The airway. And that was the reason for that. Just to clear the airway. To clear the airway of secretions. So, and that is that on that. So let's talk about its evaluation. So the first thing you bring to your brain is what? The format for evaluation, and that is what? Patient dash after dash of nursing intervention. So patient dash problem solved in the sentence. So from our outcome identification, it is what? Patient will maintain a normal respiration, right? So here it will become patient maintained normal respiration after pick the initial time 30 minutes of next intervention, and that is all. So to the potential diagnosis, I'm going to leave that for us an assignment. So it means we've come to the end of this video. So I really want to believe you get this. So if you will gain from this video, make sure you click the subscribe button and hit the notification icon so that we can notify you whenever I create a new video. And make sure you share this with a friend. So if anybody is still into this destination, make sure you invite them to it. So it really goes a long way. Hi guys.